Hello. In the next few minutes, I'm going to show you how to locate and activate 3 acupuncture points that have been used to reduce hot flashes for hundreds of years. There is a natural decline in estrogen and progesterone when a woman reaches her 40s or 50s. Monthly periods become less regular and eventually stop. Hot flashes and sweats are a common problem. Hot flashes can disrupt sleep, and some women break out into a sweat so often that it interferes with their daily living. Hormonal changes can also cause sleep problems, difficulty concentrating, moodiness, anxiety, and depression. Vaginal dryness, weight gain, dry skin, thinning hair, and a higher risk for osteoporosis are also associated with menopause. Menopause is a natural process, and treatments focus on symptomatic relief. Vaginal dryness is treated with topical lubricants or estrogens. Medications and hormone replacement therapy can reduce the severity and frequency of hot flashes. However, hormone therapy poses significant risks, and medications are more of a temporary fix, with symptoms returning if medications are stopped. The good news is that several studies have shown that stimulating acupuncture points can significantly reduce hot flashes, and in one study, night sweats were reduced by over a third in menopausal women. Another study found that women receiving acupuncture experienced less hot flashes, less sweating, less sleeping problems, and just felt better. And a 2001 review published by the British Medical Journal noted that several studies demonstrated that acupuncture has a beneficial effect on the symptoms associated with menopause. Experts in acupuncture strongly recommend that herbal formulas be taken to enhance the effect of acupuncture treatments. My name is Dr. Barrett. I'm a chiropractor, nutritionist, herbalist, and I'm certified in acupoint physical medicine. I've helped thousands of people live better naturally, and I want to help you too. If you like this video, please give me a thumbs up, subscribe, and hit the bell icon to be notified when more videos come out. The first point for menopausal symptoms is bladder 62. Bladder 62 is known as extending vessel, indicating that it opens the blood and lymphatic channels. In addition to helping reduce the frequency and severity of hot flashes, bladder 62 has been used to reduce headaches and sleeping disorders. Activating bladder 62 can reduce nervous system overload, leaving one feeling calm and refreshed. In Asia, bladder 62 is also used for stress-related pains, heel pains, and epilepsy. To locate bladder 62 on the outside of your left leg, find the tip of your ankle bone, right about here. Then move down to your off the ankle bone, just like this. Now press in to find a spot that is sensitive, sore, tender, or painful. That is bladder 62. Activate this point by rubbing it quickly 5 times, take a break for a count of 5, and repeat 4 more times. It might look like this. Or if you have a Tei Shin, it might look like this. Now find bladder 62 on your right leg and repeat. The next point for hot flashes is kidney 6. Kidney 6 is known as shining sea. Shining sea is an analogy for the limitless possibilities that can be imagined if you're looking over the ocean towards the horizon on a warm day. In addition to helping with menopause symptoms, kidney 6 is used for asthma, constipation, frequent urination, and to expedite labor, but it is not recommended during the course of pregnancy. Kidney 6 is located on the inside of your ankle. To locate kidney 6 on the inside of your left leg, find the tip of your ankle bone right about here, then come down till you're off the bone right about here. Push in to find a spot that is sensitive, sore, tender, or painful. That is kidney 6. Activate kidney 6 by rubbing this area quickly 5 times, take a break for a count of 5, and repeat 4 more times. It might look like this. Or if you have a Tay shin, it might look like this. Now locate and activate kidney 6 on your right leg. The herbal formula that I recommend for women with menopausal symptoms is Free and Easy Wanderer. In traditional herbal medicine, the name of the formula often describes the most pronounced effect. Free and Easy Wanderer refers to how a 10-year-old feels on a sunny day without a care in the world. Free and Easy Wanderer has been used for centuries to promote an overall feeling of well-being, help balance hormones, support alertness, and mental clarity. Free and Easy Wanderer is very popular, and once you give it a try, you will understand why. I've put a link below for more information about Free and Easy Wanderer. The third point to reduce the symptoms associated with menopause is spleen 4. Spleen 4 is known as the grandfather-grandson point, signifying that spleen 4 is used to address the changes associated with the cycle of life. In addition to helping reduce the frequency and severity of menopause symptoms, spleen 4 is used to help with acid reflux, upset stomach, irritable bowel, and any other symptoms associated with the GI tract. Spleen 4 is located on the inside of your foot. To locate spleen 4 on your right foot, find the base of your great toe right here. And on a skeleton, it's right over here. Now move your finger along the bone till you come to a little knob right over here. Now press into the spot that is just a little bit lower than that under the bone, right about here. Find a point that is sensitive, sore, tender, or painful. That is spleen 4. Activate spleen 4 by rubbing it 5 times quickly. Take a break for a count of 5 and repeat 4 more times. It might look like this. Or if you have a Tay shin, it might look like this. Now find and activate spleen 4 on your left side. If you are bothered by hot flashes, night sweats, trouble sleeping, moodiness, or any other symptoms associated with menopause, I encourage you to activate bladder 62, extending vessel, kidney 6, shining sea, and spleen 4, grandfather-grandson, once a day for 30 days, then as needed thereafter. I also recommend taking 3 dropperfuls of Free and Easy Wanderer 3 times a day. Once symptoms are improved, you can reduce the dose. A dropperful is the amount of fluid that fills the tube when the bulb is squeezed and released. It fills it about a third of the way. If you know someone who's dealing with menopause, I encourage you to share this video with them. It is intended to help them manage the symptoms and just might change their life. Till next time, this is Dr. Barrett signing off, yours for health naturally.